Government, we want it!
No!
The chanting started in December. It's fallen on deaf ears ever since, they say.
How has it got to this? It's just heartbreaking. Our profession is breaking.
This was the first time the Royal College of Nursing had voted to strike in their 106-year history. Today, they haven't just announced more strikes, but a major escalation. Previous action took place only during the day shift and for 12 hours each time. Now, that changes. The next strike will run continuously for 48 hours from 6 a.m. on March the 1st. For the first time, the RCN will involve nurses on emergency departments, intensive care units, cancer care and other services that were previously exempted. It will reduce services to an absolute minimum.
It's been horrible because I don't want to go on strike. I don't want to walk out on my patients, but I'm doing this because we're not retaining nurses in the profession that we need to both look after patients, to train the future generations of nurses, and to ensure that we have enough nurses to look after everybody for generations to come, because we've been treated appallingly.
120 NHS employers in England will be affected by these strikes. What the RCN have asked for is a pay rise of 5% above inflation. But the current offer is 4.7% on average for staff below the grade of doctor. In Wales and Scotland, though, where health budgets are devolved, the RCN has suspended strikes after fresh pay offers were made. The man holding the purse strings in England showed no signs of budging last Friday.
You could increase wages right now. You're the Chancellor, you're the man who's able to do that. Yes or no, are you even considering raising pay?
We will talk about anything to help people with cost of living pressures, except pay rises that entrench high inflation.
This afternoon, the Health Secretary, Steve Barclay, issued a statement saying failure to provide cover during strike action for key services like cancer care is a significant escalation from the Royal College of Nursing that will risk patient safety. We are working closely with NHS England on contingency plans, but this action will inevitably cause further disruption for patients. A government entrenched, a union enraged. 2 months in, the path to a pay deal looks no shorter.
Well, and Paul joins me now in the studio. Paul, what is your latest assessment of how disruptive this strike is going to be if it goes ahead?
Well, there's no two ways about it. This is going to be really significant, not just for the nurses involved, not just for the government, who are going to face a massive backlash about this, but also patients who need to use the hospitals during those strike days. It's important to add, by the way, this isn't every single nurse in the country going on strike. This is just members of the Royal College of Nursing. There are members of other unions who will be stepping in. But, you know, the risk is contagion. What if those other unions up the ante? We've already seen today unions, members of Royal Mail voting overwhelmingly for further strike action. Just before we went on air, I got a text from the RMT, the rail union, announcing another 4 days of strike action. Yesterday, the teaching union went in to see the Department for Education. They were told there's no more money. This is significant. People were hoping 2 months in that all of this would be slowing down. It shows no sign of it at the moment.
Paul, thanks very much. Well, joining me now is the General Secretary of the Royal College of Nursing, Pat Cullen. Pat Cullen, what possible justification can there be for staff at A&E, at cancer care, at critical care walking out?
Well, I think that's a question you need to ask the Prime Minister. What justification can he give for not coming to a table and talking to us about how he can bring these strikes to an end? And let's get round the table, let's start to talk, let's lay out our plans about how we can choose talking over strike action.
OK, so if the government
we will not be found wanting and doing that.
Right, so if the government commits to get round a table and begin negotiations, you will suspend these strikes, will you?
If the government will get round a table and meaningfully begin negotiations on behalf of our 320,000 nurses that have given me this mandate, we will be in a position to postpone any strike action that we will be taking. But we need to get to a table, we need to have meaningful talks, and we need to have meaningful outcomes.
Do you expect this strike to go ahead? You fully expect it to happen?
Look, we don't want to give up hope. What we're saying to the Prime Minister tonight, once again, is get the table set up, get the room for us, and doesn't matter what time of the day or night that is, I will be there. We have got our plans ready and waiting to be heard. We will listen very carefully to what the Prime Minister has to say. Let's stop these strikes. No single nurse wants to be on a picket line away from their patients at the beginning of March, and patients deserve better. So let's do this, and let's do it now.
OK, you talk about reducing services to an absolute minimum. What does that mean in practice for something like A&E and cancer care?
Well, I've been in talks over this last number of days with NHS leaders and employers, and I'll continue to do that. But there is no doubt there will be a significant impact as we move forward. We've had 6 days of strike. The last 3 months have been very difficult for nursing staff and for patients. But as we move forward into the next 48 hours of strike action, it will involve more nursing staff, and services that were protected in the first 3 months will not be protected as we move forward.
And that will mean endangering people's lives.
No, well, I would certainly never use the word that any nurse will do anything to endanger a patient's life. In fact, what our nursing staff have been doing against all odds within the NHS, with 47,000 vacant posts in England, is making sure our patients get the best possible services and ensuring that they reduce the risk every single day. So they are not reckless people, and they certainly do not endanger their lives.
Is this a gamble, a sort of calculated gamble, really, that you hope that by making this threat of, I know you're prepared to carry it out, but it's basically a threat to try and force ministers to the negotiating table?
Well, as a nurse myself for 42 years, and every member of nursing staff that I represent, we don't operate on threats. What we've said is, please listen to the voice of nursing, because the voice of nursing is the voice of the patient. So what we're saying is the Prime Minister now needs to take a gamble, needs to take a serious gamble and get round a table and start to talk to me, and to reduce the pressure on the NHS, to do the right thing for patients, do the right thing for nursing staff, get to the table and talk and call off these strikes. Stop choosing strikes over talking.
Right. So you have retained incredible public support for these strikes so far, despite the disruption caused. Are you worried by escalating it, you could lose some public support?
Well, the first thing I would say is to every member of public, there's not a single nurse that has received the details today about the further strikes that isn't heartbroken, just like myself, totally heartbroken that we have to do this. And for every single patient, I want to thank them, and member of the public who've come and stood with us on picket lines, stood by their nursing staff, the way that we will continue to stand by you. We want to thank you, but we will never, ever take you for granted. This is for you. This is for the NHS, this is for our patients, and it's for every single patient, those 7 million plus that's sitting on waiting lists. We will do everything to make sure you can get your care and treatment, and that we get you off those waiting lists. And the way we can do that is to get the 47,000 vacant nursing posts filled by paying nurses a decent wage, retaining our brilliant staff within the NHS, and making sure we can recruit into the profession.